The webinar will begin soon. Please stand by. The webinar will begin soon. Please stand by. Good afternoon. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on December 7th, 2022. Next slide. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2022/december.html. Next slide. Today's presentations will address one or more of the following 5 objectives: identify an implication for human, animal, and environmental health, identify a One Health approach strategy for prevention of public health threats, identify a One Health approach strategy for detection of public health threats, identify a One Health approach strategy for responding to public health threats, and list 2 ways to improve collaborative practice across the public healthcare team. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses or partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there's no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is ZOHU Webcast. To receive free CE for today's webcast, complete the evaluation at cdc.gov/tceonline by January 9th, 2023. A captioned video of today's webinar will be posted at cdc.gov/onehealth/zohu/2022/december.html within 30 days. To receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/tceonline by January 10th, 2025. Next slide. Before we begin today's presentations, Natalie Windling, Veterinary Medical Officer with the One Health Office, will share some news and updates. You may begin when you're ready.
Thank you, Laura. Good afternoon, everyone. Thank you for joining us for the December ZOHU call. We'd very much appreciate you sharing the ZOHU call website link, cdc.gov/onehealth/zohu, with your colleagues from the human, animal, plant, and environmental health sectors, and letting them know about the live webinars, video recordings, and free continuing education that this call has to offer. Before our presentations begin, I'd like to share a few updates and resources. You can find links to these resources in today's ZOHU Call email newsletter. And if you aren't yet subscribed to the newsletter, please sign up using the link at the top of the main ZOHU Call webpage. CDC's Mpox website details what we know about Mpox in animals and includes information to help prevent virus spread to pets and other animals. Additionally, you can continue to find the latest COVID-19 guidance and resources for keeping people as well as animals safe and healthy on the CDC websites listed here. Next slide, please. Today's newsletter highlights some One Health focused publications, including Zoonotic Diseases in Animal Agriculture and Beyond, a One Health Perspective, and an Anthrax Preparedness Supplement. Next slide, please. Other publications included are the 2021 National and State Healthcare Associated Infections Progress Report and Chronic Wasting Disease Detection and Management, what has worked and what has not. Next slide, please. We've also shared links to web resources, including guidance for cleaning and disinfecting pet supplies, updates on bird flu, and conservation best practices to benefit wildlife. Next slide. Finally, in addition to several ongoing outbreaks, there are 2 new Listeria outbreaks since our last ZOHU call. One linked to deli meat and cheese, and another linked to enoki mushrooms. Next slide, please. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases and find details about ongoing U.S. outbreaks on the CDC websites linked from today's newsletter. Our next ZOHU call will take place on February 1st, 2023. Please continue to send presenter and topic suggestions for future presentations, as well as news from your organization to zohucall@cdc.gov. That's ZOHUCALL@cdc.gov. Now I'll turn it back over to Laura. Thank you very much.
Thank you, Natalie. Next slide, please. You can submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You can also email questions to today's presenters. We've included their email addresses on this slide, on the ZOHU Call webpage for today's webinar, and in today's email newsletter. Next slide. Our first presentation, New Delhi metallo-beta-lactamase producing Escherichia coli among dogs living at an animal rescue facility in Wisconsin, 2022, is by Dr. Callie Habron. Please begin when you're ready.
Hi, everyone. My name is Callie Habron, and I'm an Epidemic Intelligence Service Officer with the Division of Foodborne, Waterborne, and Environmental Diseases at CDC. And today I'll be discussing a collaborative public health effort by the Wisconsin Department of Health Services, Minnesota Department of Health, and CDC to respond to an outbreak of New Delhi metallo-beta-lactamase producing E. coli among dogs living at the animal rescue in Wisconsin. Next slide, please. Before reviewing the investigation, I wanted to provide an overview of carbapenemase producing CRE. Now, I know the New Delhi metallo-beta-lactamase producing E. coli is a lot to take in, so let's start by breaking that down a little bit. So Enterobacterales are a large order of bacteria, and they include, but are not exclusively limited to E. coli, Klebsiella species, and Enterobacter species. And these bacteria are commonly found in the gastrointestinal tracts of both humans and animals. However, when Enterobacterales develop resistance to carbapenem antibiotics, the bacteria are then called carbapenem-resistant Enterobacterales, or CRE. Next slide. CRE are highly antibiotic resistant gram-negative bacteria that can cause difficult to treat infections in both humans and animals, like pneumonia, bloodstream infections, urinary tract infections, and wound infections. So a bit more on carbapenems. Carbapenems are beta-lactam antibiotics with a broad spectrum of activity and low toxicity. And they've been a mainstay of treatment for highly multi-drug resistant infections in humans since around the 1990s. And carbapenems have become increasingly important for treatment of gram-negative infections like E. coli as resistance to extended spectrum cephalosporin antibiotics has increased. And there are 4 carbapenem antibiotics currently available in the US, and those are meropenem, ertapenem, doropenem, and imipenem. Next slide. So that brings us to New Delhi metallobeta-lactamase, or what we'll refer to from here on out as NDM. So many different mechanisms can lead to carbapenem resistance, and CRE can become resistant to carbapenems through a combination of chromosomal mutations and acquired non-carbapenemase resistant mechanisms. And CRE without carbapenemases are called non-carbapenemase producing CRE. However, our focus today will be on carbapenemase producing CRE, or what we refer to as CPCRE. And CPCRE make enzymes called carbapenemases that inactivate carbapenems and other beta-lactam antibiotics, including penicillins and cephalosporins. And the presence of carbapenemase is usually sufficient to cause carbapenem resistance. And this mechanism is concerning since carbapenemase genes are on mobile genetic elements that can be transmitted from one bacterium to another, thereby leading to the rapid spread of resistance. And one carbapenemase, the Klebsiella pneumoniae carbapenemase, or KPC, was first identified in the US in 2001. And since then, KPC producing bacteria have spread widely across the country. In addition to KPC, there are a number of other carbapenemases associated with mobile genetic elements. And these include NDM, VIM, OXA48 type, and IMP. And NDM is a less common carbapenemase in the United States, but concerning because it can be resistant to even more antibiotics than KPC. Next slide. So CRE and CPCRE are generally associated with human healthcare settings and are considered a serious threat to public health. However, more recently, there have been occasional reports of CRE identified among dogs and cats. And most outbreaks involving companion animals have occurred in veterinary settings, but the overall incidence in animals in the United States is still unknown. Next slide. So now that we're all up to speed on the terminology of CRE, CPCRE, and NDM, we'll get into the investigation. So in February of 2022, CDC was notified by the Minnesota Department of Health and the Wisconsin Department of Health Services regarding a positive wound culture from a dog receiving care at a veterinary referral hospital in Minnesota. And the culture report indicated a CRE, specifically NDM E. coli. So state partners contacted the owner and learned that the dog lived at an animal rescue facility in Wisconsin. Next slide. So as previously mentioned, CRE is generally associated with human healthcare settings and occasionally veterinary settings. So the identification of NDM E. coli at an animal rescue facility was seemingly a new setting for the transmission of CPCRE. Next slide. So now diving further into the investigation. So once NDM was identified, state partners reviewed the medical records of the dog with the positive culture, which revealed a previous imipenem-resistant culture from July of 2021. And some of the animals living at the rescue facility participated in community outreach activities to schools and other events, but more notably to healthcare facilities like nursing homes and children's hospitals. And these community-based activities raised a concern not only for transmission among animals at the facility, but also the possibility of transmission between dogs and humans and spread outside of the facility. The state partners then completed site visits at the facility, and several considerable gaps in infection control were identified, but these will be covered by my colleague Nikki in the next presentation. So then state partners sought to determine if there were other dogs with NDM E. coli at the rescue facility. So to do this, a preliminary round of dog screening was performed. And given the concern about community interaction with some of the dogs and knowledge of CRE from human settings, this round of screening targeted dogs participating in community outreach activities, dogs living with the suspected index case, and dogs that arrived from international locations. And after that original round of screening, of those dogs screened, 40% were positive for NDM by CARBA-R assay. And given the initial screening results and the preliminary infection control assessment, the Wisconsin Department of Health Services, the local health department, the Minnesota Department of Health, and CDC initiated a comprehensive investigation. And this investigation had several goals. The first was to improve infection control at the rescue facility and its associated veterinary clinic. And secondly, to define the extent of spread in dogs and people. And lastly, to perform environmental sampling to assess for potential reservoirs. Next slide. So about 288 animals lived at the rescue facility at the time of the investigation. And most of these animals were dogs and cats. However, there were several birds and a tortoise. And this map you see here, which is not drawn to scale, shows a general schematic of the facility, although it does not depict the true layout. So there were 3 larger buildings. Those are depicted here in the middle, each with multiple rooms, which are depicted on the map. Around these larger buildings were multiple smaller buildings. And the color gradient here illustrates the density of dogs by housing location at the time of our visit. And the dark blue indicates the highest density with 5 or more dogs housed together, and white indicates the lowest density with no dogs housed in a room. And as the map shows, the density of dogs tended to be the highest in 2 of the larger buildings. And a few key things to note here were that animals were not permanently assigned to rooms or buildings. Staff frequently moved animals around, and these movements were not well documented or predictable. Also not predicted on this map are also not depicted on this map are outdoor areas, including smaller outdoor runs and some large fields they had where dogs from various housing areas were able to interact. Next slide. So given the mission of the rescue facility, many of the animals had serious or chronic medical conditions that required frequent or specialized veterinary care. And the rescue facility employed an on-site veterinarian who visited weekly for wellness visits and management of uncomplicated medical cases. But for complicated medical cases, emergencies, or surgical or specialized care, animals were taken either to a local veterinary clinic in Wisconsin or a referral hospital in Minnesota. Next slide. So this investigation focused on 6 response activities. First, we performed a retrospective review of laboratory data from a veterinary diagnostic lab to evaluate if there were any CRE isolates that were previously cultured at the rescue facility or the local veterinary clinic. And then infection prevention and control assessments were completed at both the rescue and veterinary clinic, which my colleague Nikki will discuss further. And next, additional dog screening was conducted following the 40% NDM positivity in the initial screening to further assess prevalence in this group. And then we looked at dog medical records from the on-site veterinarian and the vet clinic to review and gather information about screen dogs. And then environmental sampling was conducted at the rescue and vet clinic to assess for potential reservoirs. And lastly, voluntary human screening was offered to the staff at both facilities to evaluate for potential transmission between dogs and people. And risk surveys were distributed to evaluate the level of exposure and general risk for acquisition in people. Next slide. So the retrospective review of laboratory results from May of 2021 to March of 2022 identified only 1 CRE isolate. And this isolate could be reasonably linked back to the index case. And no other CRE isolates were identified at the rescue facility or the local veterinary clinic. Next slide. So additional dog screening was performed, and this is to further evaluate the extent of spread at the rescue. So a selection of dogs for the second round of screening was focused on evaluating whether there was spread to the more isolated, lower density outlying buildings, and whether the lack of infection control and higher density potentially influenced spread in these congregate living areas. And additionally, off-site dogs with strong epidemiologic links to the rescue were also included in the second round of screening. And this included breeding dogs owned by rescue facility staff that had recently had puppies that were adopted into new homes or were awaiting adoption, as well as veterinary staff dogs that regularly visited the clinic and may have had direct or indirect contact with rescue dogs. Next slide. So the results of both rounds of animal screening at the rescue facility resulted in 27 of 73, or 37% of dogs testing positive for NDM. The 5 dogs of the veterinary staff that frequented the clinic all screened negative, and 2 rescue facility staff members who bred dogs for adoption. And the first staff member home, labeled here as breeder home 1, had 9 dogs, which were a mix of adult dogs and puppies. And this staff member reported that the puppies were known to chew on the shoes she wore while working at the rescue. And of the 9 dogs in this household, 7 were screened, with 4 of the 7, or 57%, testing positive, suggesting the possibility of indirect transmission from the rescue facility to the staff member's home. And the other rescue staff member's home, depicted here as breeder home 2, also had 9 dogs, 2 of which were screened and both tested negative. Next slide. So utilizing data from medical record reviews and laboratory screening, we aim to characterize if certain conditions or risk factors were more common among dogs screening positive or negative for NDM. So cases were defined as dogs that tested positive for NDM by CARB-R-PCR, and controls were dogs that tested negative. And the analysis was limited to only the dogs living at the rescue facility. Next slide. So several risk factors were significantly associated with dogs that screen positive for NDM. And this figure summarizes the results of the unmatched case control analysis. And the odds ratio for each risk factor is denoted by a circle, and the lines indicate the confidence interval. Since little is published about the risk factors for CPCRE acquisition in dogs, we derive variables based on our observations and what is known about risk factors in humans. So note here that the significant associations are highlighted in the teal color. And the significant risk factors included dogs with documented outpatient veterinary visits in the previous 6 months, and those with a known NDM positive roommate. And dogs with an NDM positive roommate were 5.1 times more likely to screen positive for NDM than those without an NDM positive roommate. And significant associations were also found for many of the medical conditions that we evaluated, including dogs with any medical condition, paraplegia, gait impairment, fecal and/or urinary incontinence, conditions that were causing impaired skin integrity in the previous 6 months, and any antibiotic use in the previous 6 months. Next slide. So E. coli was cultured ultimately from 24 of the 27 dog samples that screened positive for NDM by CARB-R-PCR. 3 dogs ultimately had 2 isolates, which resulted in the analysis of 27 total NDM E. coli isolates that underwent short read whole genome sequencing with SNP analysis. And NDM5 was identified for all 27 isolates. And sequencing identified 3 multi-locus sequence types, including ST167, ST1163, and the majority of which were ST361, which included the suspected index dog. 1 isolate from each sequence type have been selected to undergo long read whole genome sequencing. And final analysis of that is still ongoing, but we hope the long read whole genome sequencing will help us kind of better understand whether these findings potentially represent 3 separate introductions to the facility or 1 introduction that evolved over time. Next slide. So here you can see the sequence types by housing location. Most dogs housed together appear to have the same sequence types. 2 dogs had 2 multi-locus sequence types, ST361 and ST1167, which you can see in the middle indicated by half purple and half green squares. These dogs had frequent exposure to dogs with ST361 and were known to share common outdoor spaces with other dogs. Next slide. A total of 18 environmental samples were collected, 9 from the rescue facility and 9 from the vet clinic. Environmental samples were collected from areas that could be a potential reservoir, including drains and grooming tubs, staff break tables, and other areas considered to be clean. And all environmental samples were negative for NDM E. coli. Next slide. So all humans screened negative. However, voluntary participation by rescue facility staff who had the most exposure to positive dogs was low, with only 25% screened. And this is in contrast with the vet clinic, where 60% of staff members submitted samples for screening. Next slide. So risk assessment surveys were deployed alongside the voluntary human screening. And these surveys were designed to evaluate various risk factors and exposures as well as comprehension and implementation of infection control practices. And less than half of the rescue staff completed the survey, but of those that completed the survey, approximately a quarter reported having a pet therapy animal, 14% reported a chronic medical condition, and less than half were not aware that animals could make people sick. Next slide. So conversely, 73% of the vet clinic staff completed the survey. About half indicated that they would frequently bring their pet to work. Almost a third had a pet therapy animal, and about 18% had a chronic medical condition. Next slide. So a few key takeaways from a very busy investigation. This investigation documented transmission of NDM among animals in a new setting. And a large number of animals with underlying medical conditions and those with exposure to antibiotics and veterinary environments may have made these animals more susceptible to NDM acquisition. An animal screening positive at the rescue staff member's home highlights the possibility of indirect transmission and spread beyond the rescue facility. And this may have been facilitated by suboptimal infection control practices, like not changing contaminated work shoes before going home. And stronger infection control practices at the veterinary clinic likely had protective effects and may explain the negative results among dogs and people. Next slide. So I'll wrap up with 3 public health actions that may help prevent future CRE outbreaks in animal settings. The first is timely identification of CRE. And this requires veterinarians to recognize CRE on laboratory results and understand the risks that CRE poses to animals and people, so interventions can be implemented to prevent further transmission. And then once a case of CRE is identified, veterinarians should consider engaging with public health partners. These partners may be able to assist with infection control assessments, assess potential risk of spread to animals and humans, and help facilitate additional testing if indicated. And lastly, in human healthcare settings, strengthening infection control practices is a core tenet of the public health response to contain CRE outbreaks. And my colleague, Nikki, will discuss the assessment and approaches taken towards enhancing infection control during and following this investigation. Next slide. So before concluding, I'd like to highlight several organizations that contributed to this investigation, including the Wisconsin Department of Health Services, the local health department, the Department of Agriculture, Trade, and Consumer Protection, the Animal Rescue Facility and the affiliated veterinary hospital, and the Minnesota Department of Health, and the Minnesota Public Health Laboratory, and the Minnesota Veterinary Medical Center. Lastly, the CDC field team and members of the Division of Healthcare Quality Promotion and the Division of Foodborne, Waterborne, and Environmental Diseases. Next slide. All right, thank you all.
Thank you. Our next and final presentation, the Infection Prevention Connection between Human and Animal Health, is by Nikki Mueller. Please begin when you're ready.
Thank you. Thank you for having me here today. So my name is Nikki Mueller, and I am a regional infection preventionist with the Wisconsin Department of Health Services Healthcare Associated Infections Prevention Program. And I will be discussing the infection prevention connection between human and animal health as reviewed during the CP-CRE cases in an animal rescue facility. Next slide, please. So we will briefly cover a review of the case. It is a continuation of the previous presentation by Dr. Callie. So the Wisconsin State Health Department was initially notified of a multi-drug resistant organism, or MDRO, identified as a carbapenemase producing carbapenem resistant enterobacteriales, specifically E. coli, in an animal at a rescue facility in Wisconsin. Further testing identified this CP-CRE as having the new Delhi metallo-beta-lactamase, or NDM gene, which is less common in the US. It can also be resistant to more antibiotics and transfer that resistance between organisms, making it even more concerning. CRE has been a well-known concern in human healthcare settings for years, including being labeled an urgent threat in CDC's 2013 and 2019 antibiotic resistance threats in the United States reports, and was more recently identified in US cats and dogs in 2020. This identification of CP/CRE prompted a public health investigation that found transmission of this MDRO did occur between animals on site. Next slide, please. With the index case and the initial investigation, many public health concerns were raised, including potential transmission to additional animals at the rescue facility due to the extensive intermingling of animals and humans, frequent animal housing changes that changed animal cohorts, and the shared use of outdoor runs. Also, transmission to veterinary clinic staff and patients, as MDROs were not one of the communicable zoonotic illnesses frequently discussed in this setting, and there was less awareness of potential risks and recommendations for minimizing transmission. The staff and volunteers at the rescue facility transmission was a concern due to their close interaction while feeding, caring for, and cleaning up after the numerous animals on the property, and the surrounding community through risks in excrement disposal, staff inadvertently spreading to others in the community, and potential transmission through public contact with animals as part of fundraising efforts, tours, and visits to other facilities. While there are studies that show transmission can occur from animals to humans and humans to animals, there's not really enough known about the frequency of this transmission. There was a report from Switzerland in 2019 that suggested transmission between humans and animals, with an animal hospital personnel identified as being colonized with the same CP/CRE that was identified in some of their respective clinics' patients. Another incident at a U.S. veterinary hospital identified around 15 cases of CP/CRE in their patient population. There was no indication of transmission to staff, but the possibility is there. These cases can be used to stress the importance of infection control precautions in animal settings. Next slide. Upon notification of this positive isolate, numerous partners within the state of Wisconsin were called to consult on this unique situation, including the Department of Health Services, Division of Public Health, Communicable Diseases, Epidemiology section, which involved the Wisconsin State Public Health veterinarian and other veterinarian epidemiologists for their expertise with zoonotic diseases and veterinary care practices. The HAI Prevention Program for its ongoing work with CP/CRE and infection prevention education. The Department of Agriculture, Trade, and Consumer Protection, or DATCAP, which is responsible for state licensing of agricultural and veterinarian sites, among many other responsibilities. As part of the licensing process, DATCAP also performs annual inspections of facilities like this statewide. The Wisconsin State Laboratory of Hygiene, which serves as the Midwest Region Antibiotic Resistance Lab Network Laboratory, provided consultation for human testing and result interpretation. They offer testing to the staff of all locations to determine transmission levels between animals and humans. There were several local health departments involved that included the rescue site's county of residence, but also surrounding counties that house the outside care clinics. Next slide, please. In addition to the internal partners, there were many outside Wisconsin, including Centers for Disease Control and Prevention, the Minnesota Department of Health, which provided the initial clinical specimen testing, identification, and notification. Our Minnesota Department of Health colleagues included their epidemiology team, the Public Health Lab, which is another ARLN lab that handled the animal side of testing, and a vet infection prevention and control specialist who worked closely with the Wisconsin IP and vet EPIs in this investigation to provide this specialized expertise. The rescue director and the facility staff, including contractors, and the local veterinarians and veterinary clinics. The rescue facility has a local veterinarian that provided care at an on-site clinic area, and the facility was also working with several private practice clinics in the area, including sites in Minnesota. Next slide, please. Initially, the team discussed the current situation with the facility director to learn more about practices within the facility and potential gap areas. In addition to the on-site animal care staff, there was a contracted cleaning service on-site 7 days a week that cleaned the main areas of the facility, in addition to the routine rescue facility staff cleaning responsibilities. As these discussions continued, there was increased collaboration as different partners were pulled into the investigation. And over the course of the investigation, many on-site visits were made to the rescue facility and to the surrounding veterinary clinics to determine the extent of transmission, modes of transmission, and to aid in determining needs and future goals. Several members of the different partner groups were on site at various times throughout the investigation to consult on aspects of surveillance or infection prevention. There continued to be visits with the facility to maintain the relationship and provide ongoing support. As the infection prevention and control subject matter expert, I was on site many times over the course of the investigation with partners and without to work through the recommendations and workflows at the facility. I have continued to maintain contact with the rescue facility and the cleaning service staff and provided on-site visits to work through those processes, answer any questions they may have. We also provide consultative visits to any additional clinics that provide care or plan to provide care for the high acuity animals from the rescue facility. Next slide, please. Through the on-site visits, several large gaps were identified. MDRO presence and transmission in animals was newer to some of the veterinary professionals. This included less familiarity with these resistance patterns and the potentially serious risks associated with MDRO transmission of this type, both to other animals and to people. High-level awareness of the types of MDROs that may be more commonly present in certain parts of the country or world would be helpful in generally assessing this risk. While human healthcare places a lot of emphasis on MDROs as part of care and cleaning practices, increased knowledge about transmission across species and general infection prevention methods could be helpful in animal care. This could also include surveillance through lab reports, particularly in higher risk animals, such as those with chronic wounds, and having contact with animals or humans with CRE. The rescue facility staff were largely unaware of zoonotic illness risks with MDROs. While the staff were aware of some of the more common zoonotic illnesses, they were not aware of MDROs and the risks that these organisms present to themselves, their families, and to the other animals on site. A survey of veterinary clinic and rescue facility staff assessed individual risk factors at work and in their homes, as well as their baseline knowledge on MDROs in animals that could then be used to develop education to address these identified gaps. There was also room for improvement in a variety of infection prevention basic techniques at all locations. Many leaders and staff did not have enough background infection prevention and control knowledge to develop and enforce these practices through routine auditing and education. Increased use of regular hand hygiene, personal protective equipment, separation of clean from dirty, standardized cleaning and disinfection practices, and quarantine and cohorting to limit spread of communicable diseases were needed changes, particularly in the rescue facility. The public health partners worked with all facilities to obtain additional supplies, such as wall-mounted alcohol-based hand sanitizer, gloves, boot scrub stations, PPE, and other tools to help to decrease transmission. Staff also worked on space management, including altering placement of animals, staff break areas, and treatment spaces to help reinforce clean and dirty areas. And a large number of the on-site education was staff involved communicating the whys of these altered or new practices and creating a safe place to ask questions and foster learning. Next slide, please. As mentioned, infection prevention and control basics were notable gaps identified in all sites, and IPC techniques are crucial to prevent the transmission of MDROs or any communicable disease. To begin with, we needed to provide education on what MDROs were, what was initially identified at the rescue site, and ways to prevent the transmission of MDROs and other zoonotic illnesses. The first prevention technique covered was hand hygiene. Hands-on education opportunities were provided to staff at all locations, focusing on the importance of hand hygiene and the actual process of glove removal to prevent contamination. The facilities were instructed that it would be best to increase the availability of alcohol-based hand rub, along with providing signage to remind staff to perform hand hygiene to increase overall staff compliance. Personal protective equipment was introduced and discussed at the rescue site. Return demonstration and hands-on education was provided to staff at both the rescue site and the veterinary clinics to ensure proper donning and doffing. Staff were educated on the selection of appropriate PPE for their specific tasks and the proper utilization of the selected PPE. Workflows were reviewed and discussed to determine the best practices for the sites, and these processes were then documented as policies and taught to all staff. Cleaning, disinfection, and proper sterilization is another crucial part in IPC. Processes, workflows, and available materials within this setting were taken into consideration when discussing best practices for the rescue facility and veterinary clinics. Staff were provided education and reminders on how and when to use certain equipment or disinfection agents and who would be responsible for each stage of cleaning and disinfection. We worked on developing a list for them to maintain the wet contact times on each product that would be used in order to have the greatest level of efficacy. Product expirations and overall indications were reviewed to determine which products would be the safest and most effective. And for the clinics, sterilization techniques were reviewed to ensure equipment was being maintained sufficiently and proper sterilization techniques were being used to prevent spread via contaminated equipment. Next slide, please. Another infection prevention and control practice incorporated into the education process was the importance of separation of clean and dirty. This included the animal waste products, cleaning products, linens, toys, food and water, etc. In both the clinic setting and the rescue site, there was not complete separation of the human break areas and animal areas, or separation of clean versus dirty. To minimize the risk of contamination and transmission, human break areas needed to be separated from the animal spaces. At the rescue site, it was noted there was limited space and capability for this complete human and animal separation. Therefore, recommendations for temporary accommodations were discussed and reviewed until a more permanent solution can be established. Quarantine and isolation processes and the importance of these processes for animals with communicable diseases was reinforced. A process on the rescue site was determined to try to minimize the transmission risks among the other animals at the facility. This did include a separate isolation area for animals with active infections that also maintained a separate outdoor area for these animals to help minimize the movement and relocation of animals on site. The vet clinic's workflows and available areas were reviewed to help determine the best options for seeing and providing care to those animals that may have communicable diseases. And these options included rooming right away, utilizing an area with immediate outdoor access to the care area rather than moving animals through the clinic, using proper PPE for given situations, and reviewing cleaning and disinfection opportunities. With collaboration across the veterinary clinics and the rescue site, a process was established and agreed upon to help decrease risks of transmission, to allow the clinics to continue to provide care to any affected animals from the rescue facility. So this process was incorporated into the care appointments for the rescue facility when off-site care was required. Both the clinics and the rescue site created and integrated additional policies and procedures into their practices to ensure proper infection prevention and control in the facilities, while also incorporating it into the facility's workflows, onboarding, and continuing education. Next slide, please. Our team continues to work closely with the rescue site. Over the past 10 months, we have provided infection prevention and control and MDRO education for staff in services, including the initial background information, onboarding education for new staff members, and annual refresher information for all staff on site, including the contracted cleaning staff. New practice and policy reviews to integrate these education lessons learned to help reduce transmission risks within the facility and for care sought at offsite clinics. This included recommendations for staff clothing and footwear. As Callie indicated, many of the staff were wearing the same clothing and boots from the facility, and they were wearing it into their personal vehicles and then into their homes. We incorporated guidance to change clothing and leave their dirty boots at the facility to help reduce bioburden and communicable disease risk to the surrounding community and personal residences. Ongoing support through continued check-ins, both virtually and on site, that measure the ongoing progress with the initial summary of recommendations provided by all involved partners and compliance with requirements. I also continue to be available to any staff that have questions or concerns. Next slide, please. For the veterinary clinics that have cared for animals in the past or will be newly caring for animals from the rescue facility, we offered educational support to address the IPC and MDRO education for staff, including ongoing consultation for questions and concerns. We also had the collaboration on safe care practices for animals from the rescue site and for general communicable disease management for all patients within the clinics. And this does include consultation with any additional care sites or current site concerns. Next slide, please. While several outcomes were established throughout this collaboration and an investigation to date, a few selected ones included the creation of executive summaries for the recommendations made by each partner agency that were then collapsed into one easier to use document and provided to the rescue facility, the on-site vet clinic, and private veterinary clinics. With the introduction of each recommendation, we have worked to incorporate them into the workflows and create processes that are attainable at each site. And one recommendation included constructing a new building, as the rescue facility had previously considered, in order to provide additional clean space for staff, animals, and veterinary care. And we continue to work with the Rescue Center to provide recommendations for the future use of this new space and how to maintain that human and animal separation. Next slide, please. Additionally, through this process, we have learned more about and promoted greater awareness of MDRO concerns in animal environments and the associated impacts to local and human and animal communities. We identified the needs for veterinary clinic and staff education opportunities, not only for those connected to this case, but to the larger veterinary community. And this has opened a great collaborative effort among internal and external entities to promote the One Health initiatives and efforts. Next slide. And I'd like to also provide acknowledgement and appreciation to all the different entities and peoples that helped us with this investigation and follow-up. You saw them listed in Callie's presentation. Thank you for your time, and I think we would be ready for questions.
Thank you. Next slide. Thank you to both of our speakers today for their informative presentations. We do have links to resources from each presentation available on our website at cdc.gov/onehealth/2022/december.html. We do have time for a few questions, so please use the Q&A feature in Zoom to send your question, and please include the presenter's name or topic. So for our first question for both of our presenters, why do you think that fewer rescue staff voluntarily participated in screening, and what thoughts do you have on how to increase that participation?
Nikki, I can start with this one. So, we have a few challenges. The screening for CPCRE is a stool sample, which is not not as easy as asking, for a nasal swab. And a little bit of a difference between the rescue facility staff and the veterinary staff. We had a lot of buy-in from the veterinary staff and some of the senior veterinary staff, and they almost kind of got together and made we'll all bring in our poop samples together and really kind of encouraged each other. The rescue facility staff on average was a little bit younger as well, and I think there was some hesitancy potentially and some concern about bringing that a stool sample in, given the limited time we had with the staff, and given a lot of variability in the hours that staff worked, we were only able to kind of address all staff members at once to discuss screening. And in hindsight, if maybe we had been able to work with smaller groups or one-on-one to discuss this screening, any concerns, and talk individually, maybe we could have allayed some of the either embarrassment or concerns around screening for CPCRE. Nikki, I don't know if you have any other input.
No, you summed it up great, Callie. There's a lot of learning opportunities that we can take away from this.
Great, thank you. Our next question, was any recommendation given to the rescue with regard to ongoing activities in the community with dogs from the rescue, like visiting schools or healthcare facilities?
So I can go ahead and start with that, and Callie, you can add anything if you'd like. We did discourage and discontinue any off-site visits currently until we can get the rescue site to a great place that we can potentially look at that in future cases. So at this point, they are not doing any off-site visits or anything like that. Kelly, I don't know if you wanted to add anything.
No, I think that's about all.
Thank you. Were any animals other than dogs at the rescue tested, and what were the results of study?
Yeah, so we did test several cats in various locations, as well as the tortoise, and they all did test negative. The reason our focus was on the dogs is the cats were housed while there was potentially some dog interaction. There was very kind of minimal. So our focus, and given the kind of constraints on the amount of testing we could perform and reducing stress as far as testing, our focus for this investigation was on the dogs, but of those cats and tortoise screen, they were negative.
Thank you. And our next question, what kind of cleaning solutions were they using at the facility, and were they effective against this bacteria?
So in the beginning, they were using a bleach dilution, which we did work with them to discontinue. We did find a certain company that did have claims against E. coli, which would be effective against this organism as well. And I'm not sure that we can really say which brand or anything, so I will leave that off.
Thank you. There is a question about, given that many veterinarians and others working in animal settings are facing staffing shortages, and burnout. Could you talk a little bit about any challenges you faced regarding that and how you were able to engage these stakeholders?
So, both the rescue facility and the veterinary clinic were very involved and very receptive to all of the work we did with them. I think as far as shortages go, I don't know if that there wasn't something we were addressing or really concerned about here. Is mostly education, and I think the education that Nikki did, the education that we did on site is just there's nothing super novel about it. It's just taking the time to really reiterate the importance of just those basic IPC standards, things that we've all heard a lot in the last 2 years, the importance of washing your hands, especially between animals, making sure appropriate contact time in the veterinary clinic and in the rescue setting are being utilized, and thinking about the movement of the animals. But again, these are things that I think we can implement everywhere in our everyday lives, and certainly in veterinary settings. Nikki, I don't know if you have anything to add.
I completely agree with you, Callie. And I know our facilities were short-staffed, but we really didn't take that into consideration, as Callie mentioned.
Thank you. And then our next question, at a national level, are there any plans to work with veterinary schools and professional organizations to improve veterinarian awareness around this? And then I'd also like to tack onto that, in addition, are there any plans to work more generally with rescues and shelter organizations as well to educate them about this topic?
So I'll start with that. So absolutely. I mean, this is certainly as we mentioned, a concern, and seeing this in what we consider a novel veterinary setting. Part of us getting the message out there is platforms like this, and presenting. There's work being done at some veterinary schools as well, and on CRE, and looking at bigger conferences. But, again, sharing these resources, with your colleagues, making them aware of CRE, but again, ongoing to get the message out there as this becomes a growing concern, and educating veterinarians, veterinary staff. Absolutely. This is work being done in this space by multiple partners. Nikki?
I agree. We're hoping to get this information out far and wide so everybody can be aware of situations like these.
Thank you. Let's see, next question. Could you talk a little bit more about how you perform the environmental sampling, and have you continued to conduct environmental surveillance?
So the environmental sampling, as I said, there were 9 samples taken at both facilities. All were negative. What we did is we swabbed areas, identified areas that we would consider to be either areas that could be a reservoir for CRE, or were considered otherwise, should have been clean. And some of those were high touch areas. As far as I understand, and Nikki, correct me if I'm wrong, I don't believe y'all continued any environmental surveillance. Given that all of those were negative, I don't know if we saw a lot of good putting additional resources that way. But Nikki, I don't know if y'all have done any follow-up.
We, as you said, we had all negative, so we did not continue with environmental sampling.
Thank you. Then we have time for one last question. Are CREs isolated from animals reportable or required in every state?
They are not. They are not reportable in Wisconsin. I don't know of many states that it is required.
Thank you. If you have other questions for today's presenters, we have included their email addresses on this slide on the ZOHU call webpage for today's webinar and in today's email newsletter. And a reminder that a video of today's webinar will be posted within 30 days on our website. Next slide. Thank you again to both of our presenters and for everybody attending the call. And please join us for the next ZOHU call on February 1st, 2023. Thank you for your participation. This ends today's webinar.